So for the common iliac vein, is a vein of the lower limb, and let's get to identify it on this picture. So this is the common iliac vein. So the common iliac vein is there, so that the common iliac vein is actually a large vein in the pelvis. So it's formed by the union of what? External iliac vein and the internal iliac vein. So it drains blood from the upper limbs and the pelvis. Okay, so what's the anatomy of the common iliac vein? It forms as a union of external iliac vein and the internal iliac vein. Okay, so external and the internal are coming together, and when they come together they form a common root, which is now known as a common iliac vein. So it runs upward along the pelvis brim. The right common iliac vein is shorter and more vertical, while the left common iliac vein is longer and more oblique. Termination. The right and left will now join. Okay, right and left will now join. Okay, so I think this should actually give a very much more better insight of it. Okay, so this is that should be the right common iliac, and this should be the left. Okay, so they join at this region. Okay, so tributaries, they receive venous blood from both external iliac vein and internal iliac. So relationships: right common iliac, it lies posterior to the right common iliac artery, while the left common iliac crosses anterior. Okay, it's crossed anteriorly by the right common iliac artery. Okay, so drainage: it collects venous blood from the lower limb, from the pelvic organs and the walls. Then it will now drain into the vena cava, inferior vena cava. Now we'll study about this vein simply because the vein is important to know about: deep vein thrombosis, the May-Turner syndrome, which we'll get to discuss, surgical relevancies, and also imagings. Okay, so that's it.